All right, welcome back, everyone. I'm going to go ahead and get started reading Dr. Yu's bio so that he can jump in with his lecture and we can get a lot of good information. Dr. Simon Yu is a board-certified internist who founded Prevention and Healing to offer integrative medicine to patients from St. Louis, across the nation, and around the world. He wrote 2 books, Accidental Blow Up in Medicine, The Battle Plan for Your Life in 2019, and Accidental Cure, Extraordinary Medicine for Extraordinary Patients. They give unique insights from his work at Prevention and Healing, learning Eastern, Western, and innovative medical technologies, and 25 years in the U.S. Army Reserve Medical Corps, from which he retired as a full colonel. Dr. Yu trains physicians, dentists, and prescribing health professionals in acupuncture meridian assessment, which is an updated, digitized method that provides forensic insights into problems underlying many chronic illnesses. AMA can be used to detect and monitor treatment of parasite and fungal problems, hidden dental infections, immune and toxicity reactions to dental and medical device metals and chemicals, and the growing epidemic of allergy immunology problems. He is a leader in detecting and treating dental, fungal, and parasite problems overlooked by conventional medicine. His talk today is Parasites and Dental Problems, Missing Links When the Latest Medical Therapies Have Failed. Dr. Yu, you have the stage. Thank you.
Okay, for everybody, I will be talking about parasite and dental problem as a missing link, why people are not getting well. So my topic will cover for infection, inflammation, and immune dysregulation. And all day we covered about infection, inflammation, and immune dysregulations. And for me, I pick up the information through acupuncture meridian assessment. Okay, actually I give a very similar talk at bottom last year. There were some few changes in slide, and there would be a basically same concept. So parasite and dental infections are often missing link for overlooked inflammation and immune dysregulations. And the main topic is that there is a new way of detecting parasite and hidden dental problems using current technology, which is based on EAV, electroacupuncture, according to Dr. Ver. And I simplified and I call it acupuncture meridian assessment. And the backing with the DNA test as a forensic evidence. Now, this is a busy slide, but this will give you some general introduction of what I do. I measure 40 main acupuncture points, 10 points each hand and 10 points each feet. And what I'm looking for is a pattern recognition developed by Dr. Ver, call it electroacupuncture according to Dr. Ver. And this is what I call 5,000-year-old new disruptive technology. And if you look at the slide, now green means within normal range. The scale is from 0 to 100. Normal range is from 45 to 55. That's a green zone. Consider acceptable normal range. Red means inflammation, more recent inflammation. Blue means it's a chronic degeneration, or we can call it chronic silent inflammation. So in this particular case, this patient about 20-some meridian is out of balance. This patient happened to have autism, and give you some scenario will be like this. I have a 39-year-old white female came from Texas with a Lyme, chronic fatigue, neuropathy, and multitude of the symptoms and dental problems. You check those meridian system, looking for the pattern. I don't have time to go over those individual meridian system, and I'm basically trying to inspecting the violin and tuning the violin as a metaphor. But in this particular patient, based on the meridian system and patterns, I gave a triple parasite medication, and she felt so much better. What she didn't tell me was she had a 5-year-old severe autistic child, and she gave her parasite medication to a child, and within a few weeks, he was able to start talking. Now, when I found out, I was not happy about it. And I ended up seeing the boy because I don't usually see the children. And I had to change to a different kind of parasite medication. And I also check for heavy metal problems, which his mercury level was about twice as concentrated as his mom. And within a few months, his ATEC score came down from 109 to 9. So, so what I'm looking for is a pattern recognitions based on acupuncture meridian assessment. So EAV developed by Dr. Varn. And for myself, I've been doing this EAV for 30 years. And along the line, I have a hard time truly understanding homeopathic principle. I'm an internist. And I start simplifying how to get to the point. And I check 40 points. It takes less than 10 minutes. And one of those, most of these classical EAV practitioners will say, I'm not doing EAV, yet I'm doing something different. Whatever it is, I'm not doing classical EAV. So I changed the name to acupuncture meridian assessment is a correct description of what I do. So I measure this point, 10 points in the hand on the right side and 10 points on the left side, called control measurement points. And on the foot, also 10 points each, right side and left side. So what I'm doing here is focusing on what's the really underlying problem. I'm not really interested in diagnosis. What's the underlying problem? I'll be looking for infections, parasite, fungi, bacteria, virus, all those environmental toxins, heavy metals from the environment, and nutritional deficiency or nutritional imbalance. And I look for, actually, I don't spend too much time on genetics. Most people already have done genetic tests and looking for any cell signaling as a cytokine, chemokines, and all those other factors, social, dental, EMF, and toxic emotions. That's all driving metabolic dysfunction, mitochondrial damage. It will manifest into extracellular matrix. And you'll see Lyme, post-Lyme, chronic disease, and cancer. And for me, I'm looking at from meridian system, measuring at the extracellular matrix, measuring what the underlying problem is. So it's not just checking all those tests, what is the biggest problem is coming from, and I have to prioritize the underlying problem. Now, I'm not going to go over all those statistics, but this is a general statistics. You can go through it. You can get from internet at the CDC or WHO. Just give you one example would be Ascaris. They talk about 1 billion to 1.5 billion people are infected by Ascaris, and over 60,000 people die every year. And I'm always questioning the validity of statistics, where the statistic is coming from. And what they don't tell you is many people Ascaris may die from perforation of the GI problems, or from actually from asthma. They can look at the flukes, schistosome, the malaria, and there are millions and millions of people are dying every year. And parasite is one of the leading cause of morbidity and mortality in global. So, the whole list of the symptoms, I'm not going to go through it, but it can cause a lot of also behavioral problems too. So parasites are the major trigger for what I call silent inflammation, especially coming from. All right, so this just using parasite and fungal medication for targeting cancer cells. And one of my also article I usually encourage people to read is a parasite treatment hacked by an MIT engineer. She figured out what I was doing. She came as a patient and in the internet, figuring out how to do muscle tests, how to get the parasite medication. I don't officially endorse it, but I can only see so many patients, and people can learn quite a bit from this article. go to her website. And also the other one will be cancer is an infectious disease, as cancer is a metabolic parasite.
Just go ahead and click on, there you go.
Yeah. And I'm going to skip this because anyway, dental related problems, dental can cause what I call murder by dentists, accidental blow up in medicine can cause so many dental distress and TMJ disorders. These are all in my website. Now, this is actually a busy, I'm not going to read this whole slide here, but one thing I'd like to point out will be the immune dysregulation, Th1, Th2, Th17, and Treg17, and how they're all interrelated. And especially called rentis is called CCL5. That's regulated by T2 cells, and T2 cell is also going after the parasite problem. Often what we'll see is, dental cavitation will have a marked rise in rentis, and what people don't realize is that there's often dental parasite, the entamoeba, that would create what we call very high in rentis. So parasite-derived chemokines and antigens can induce cell migration by stimulating chemokine receptor cells, and rentis, the CCL5 is one of the major inducing for chemokines by the parasite. So whether you have autism, asthma, cancer, or MS or seizures, the tipping point, the Th1, Th2, Treg, and Th17, where is the missing link? What drives this individual tipping one side or the other side? And I'm trying to convince people that it's a hidden dental problem and parasite problem. It's not usually genetics. It's the epigenetics from missing dental and parasite problem. So if you look at from evolution point of view, we have a universal ancestor with the RNA and DNA. We have here the prototype eukaryote protozoa, we have a bacteria, plant, fungi, animal, Homo sapien, and parasite, and go through the whole evolution. So we have like a coronavirus is an RNA virus. By the time this, we have an infection, like a pneumonia, you don't have just a viral infection. Sometimes we'll have a parasite, fungi, and bacterial infections. And parasite is probably the, what I call I don't know what's the best way to describe that, the top of the food chain. And then we have a fungi as one of the chief undertakers. And we are designed to, evolving to survive from the parasite and fungal infection. So let's start with a case study here. He's a 52-year-old Boeing engineer, squamous cell cancer of the right thumb. And I've known him for over 10 years, and he had a irritable bowel syndrome, ulcerative colitis. And I told him 10 years ago that he had to pull one of the bad tooth, and he was very skeptical. It took him about a year to do it, and his ulcerative colitis went away. And then about 8-9 years later, he came back with a pus draining his right thumb. When I see it, all I see is one reading is out of line. That's right here. This is a lymphatic system of the jaw, or referring to a dental point. I sent to the dentist, and the dentist said everything is fine. X-ray does not show. They do muscle test, they do CT scan, cone beam, CT scan, nothing shows. Meanwhile, this draining pus in the right thumb is turning into a fungating squamous cell cancer. Eventually, they did a biopsy and recommending to amputate the thumb. And only thing I see is actually dental problem. And we go back and forth over a year, year and a half. And when he had to realize he had to amputate his thumb, he decided to go talk to the dentist. I don't care, just pull the tooth I've been recommending for the last year and a half. And the dentist didn't want to do it and agreed with him that to sign the consent form not to sue him for pulling the normal looking tooth. And when I found out, that was about now 4 years ago, I request for DNA test as a forensic evidence, see what kind of microbe might be growing in the hidden tooth that I'm keep picking up for the last year and a half. So when you see this, the picture right here, the point, there's actually some infection down here that was pulled. Initially, his swelling thumb and fungating tumor got better, and they started regrowing again. And the other one was also showing up as a dental problems. And eventually that tooth was pulled. So then one of my big question is how important it is getting x-ray or cone beam CT scan. And when they did pull the tooth with the DNA test, look at some of all those microbes from Provotalon, Serratia, Enterobacteria. Here's a entamoeba, it's a big one, it's a parasite, and all lists of the problem, including actinomyces and cytomegalovirus. So what I learned from this, you cannot still trust dental x-ray, even cone beam CT scan. You have to go beyond CT scan. You have to get into a subtle energy field. And when I checked, I did put on actually before the dental operation, triple antibiotics. I put on amoxicillin, doxycycline, and clindamycin, and for 3 weeks. And within 3 weeks, his tumor was shrinking very rapidly, almost back to normal. But the oncologist still recommend radiation therapy to be done, which I didn't want him to do it. And eventually, he did a radiation, and actually the cancer spread to his lymph in the armpit, spread to the lung. There's no guarantee I could help him, but this is the kind of reality I deal with. Even if you correct the underlying problem, they still want to do chemotherapy or radiation therapy. And over here is a dental tooth organ dental chart. It is available in my website, connecting the dot between the dental infection and the rest of the body. Here's another case here. Here's a 5-year-old boy with a nephritic syndrome. I saw him on February of 2012, developed nephritic syndrome in January of 2012. He started falling and hitting his face and teeth on December 2011. Seen pediatrician and dentist, everything was fine, including normal dental x-ray. Symptoms: abdominal bloating, puffy, extremely weak, heavy protein in his urine. When I checked, dental and kidney was out of balance. So if you look at from here, that's the dental of the lymphatic system. Here's another dental on the right and left, allergy, immunology point, and here's a kidney point. When I saw that, I recommend to put those 2 infected tooths. It usually takes several months to convince the dentist, and when we finally put the tooth, all his meridian system came back to normal, and his nephritic syndrome went away. So all those simple child trauma, falling from on the floor, bicycle accident, kind of minor sports injury, that can be triggering for many years down the road. And I can pick up through what I call measuring the subtle energy field, meridian system. So here's a 45-year-old female, end-stage kidney failure, stage 5, recommend dialysis or possible kidney transplant. I saw this patient January 2020. So we're looking for the pattern. The dental problem was there, dental problem is right here, kidney problem showing up on the other side here. He's got creatinine over 4.4, rapidly deteriorating kidney functions. They don't know why she's having a kidney problem. and recommend dialysis and possible kidney transplant. I recommend 4 teeth to be removed. I have not seen a bag yet. And also prone parasite medication, parental palmoid, praziquantel, tanadazole, and doxycycline for 30 days. And usually if you don't do this, people end up having a total renal failure. The one I marked was the infected tooth. And it's not really easy to convince these people. It will take many months to convince them to get the dental work done. Here's a 11-year-old boy with asthma, chip complaint, asthma diagnosed at age 9. Also complaining of breathing problem, tightness in the throat, but also complaining of leg. When I checked the meridian system, disturbance in the gallbladder meridian, liver, lung, and pancreas meridian, Cremon alenium, and repeat 3 weeks later. And there's a dramatic improvement in his breathing, but also his leg pain went away. All those what we think is asthma often respond to parasite medication. Here's a 16-year-old girl with a lupus, Sjogren, dry eyes, dry saliva, diagnosed at age 10, and have an eventual kidney failure. Only thing I see is right here is a dental problem. When you look at the dental x-ray, she has 4 infected teeth on the bottom. Trying to convince several dentists, I mean, I'm talking about biological dentists, they do CT scan, muscle tests, nothing shows, and I cannot even convince any of them to get the tooth to be removed because of the legal liabilities. And just give you an idea how difficult it is to convince connection with even if you found out what the problem is, sometimes you cannot even get the dental work done. So I use this as a sort of a metaphor. It's called enhanced interrogation technique or advanced interrogation technique. Sometimes nothing shows and put one needle in and there's a dramatic effect. All the problem shows up spontaneously. So I call that quantum effects. And so here's a tale of what I call 2 Lyme patients. 65-year-old white female from Agenex IgM and IgG test negative, clinically diagnosed Lyme with chronic fatigue, myalgia, neuropathy, brain fog, not responding to IV antibiotics, ozone IV laser therapy, specially designed for Lyme patients. And she was just coming from Germany, but she's living in Midwest, and her husband is Agenex positive for Lyme, for IgG and IgM, and he is totally asymptomatic. So what was the difference? The difference was that his wife has 6 root canals. That's the only difference of all those symptoms mimicking like Lyme. Here's a 34-year-old chiropractor with a chronic fatigue, neuropathy, and questioning about the Lyme. And I don't usually do Lyme tests. A lot of time, those tests was already done. And if you get all the list, you have all those infections. This is from DNA connections. We have a treponema. That's a spiral kid infection that will mimic often like a Lyme. And also in, I think this patient does not have entamoeba. Often I will see parasite, the protozoal infections. So if you don't address dental infections, they will be treated with antibiotics, feeling better. When you stop the antibiotic, the symptoms come back. So this is a DNA forensic evidence. I always look for requests for dentists for the last 4 years since my Boeing engineer case as a means to have a, what I call forensic evidence. With a Lyme, tick-borne Lyme co-infections. I look for all those different parameters, and I always look for parasite and spirochete infections. This is from my first book, comparing is a Lyme disease really truly a Lyme or possibly a hidden dental problem. So talking about Lyme and beyond Lyme. And there's a spirochete, we have a Borrelia burgdorferi, Treponema pallidum as a syphilis. And then there are many different types of Treponema mimicking as a, for Lyme are actually periodontitis. Here's a patient with Lyme. He was on IV antibiotics for 10 years, on and off. He said he's feeling better, still have some residual symptoms, and when I saw him, only thing I see is a dental problem. And I sent to the dentist, they did a CT scan, and they put a 4 spot, and they said these are the areas for the need a dental cavitation operation. And in my energetic test, one was a definite for cavitation, one maybe, and 2 of them, I don't think there's a active cavitation. At least I don't see the infection. They just have a hollow space. Just because there is a hollow space, which is by definition of a cavitation, does not mean you need dental operation. So how can you tell the difference between the active cavitation from infections and from actually there's the actual infections? For me, I check for acupuncture meridian assessment. So he can do maybe 2 out of 4 areas may need dental operation, but not 4 out of 4. That will become an unnecessary operation. And I see this kind of problem quite often. They end up getting unnecessary dental operation. So here's a 49-year-old female from Michigan with an atypical questioning ARS, numbness of the face, leg, hands, extreme fatigue, weakness of the muscles, pain, possible Lyme. When I checked, 34 out of 40 meridian was out of balance. As a rule, I usually start with a gut, starting with a parasite medication if it is indicated. In our case, ibuprofen, ivermectin, praziquantel, tinidazole, wormwood, and antifungal medication, fluconazole. DMPS, heavy metal test shown very high mercury with 8 amalgams and very high ochratoxin. It took about a year and a half to rebalance the system, gradual change to in the bottom from here down here. And one of the biggest stumbling block was actually a dental problem. So if you look at from here, so normal looking dental x-ray is not the best quality x-ray. And she's a dental hygienist, and CT scan looks fine. And dentist refused to pull the tooth, and it took her over 1 year to convince the tooth. That's when she finally turned around and all the symptoms went away. I know we have a case talking about migraine earlier today. I look at all those different parameters. And one of them I always look for is parasites, especially for ocular migraine headache. I will be checking on the foot. And if you follow the line, you can have some people have a foot problem, ankle problem, knee problem, hip problem, back problem, flank pain, a GI problem, shortness of breath. It will wrap the brain around, that can cause a headache, migraine headache, concentration problem, sleep problems, ringing in the ear. It can cause eye vision problems, just with a 1 meridian system. Epilepsy and seizures, always look for dental problem. If somebody's 19, 20 years old and developing seizures, there's a very good chance he have some cavitation and wisdom tooth areas. And for young children, often have a parasite problem. When they start crawling on the floor, they often pick up parasite from the floor, whatever is in there, and playing with the animals. So people always ask, how did I get into parasite? And I'm an internist, and I've been doing this EAV, or I call it Acupuncture Meridian Assessment, for the last 30 years. And year 2001, I was in the U.S. Army for 25 years. We are in Bolivia, in Oruro, and we are going to a small town. And we have a small team, and we give everybody a parasite medication. Either we give parental palmoate or mebendazole. And before 2001, I never really used parasite medication, because even if you think patient have a parasite problem, when you check, nothing shows, and out of maybe who don't have a parasite problem in the United States. I've been doing meridian testing before that, and so when I pick up large intestinal meridian is a problem, somebody have IBS, I will use natural parasite medicine, like a Hulda-Clark's wormwood, black walnut, and clove oil, and patient gets better. Their IBS goes away, patient is happy, and I'm happy. Since 2001, I decided to use parasite medication just as an experiment for somebody picking up GI problem, when they show large intestine or small intestine. And there's some dramatic changes in response. Not only their IBS get better, sometimes patient will say, my asthma went away, my fibromyalgia went away, my hip pain went away, my knee pain went away, my migraine headache went away, my diabetes under control, and sometimes patient says, my tumor become more stable. This is a sort of a hard to believe this was happening when I was actually using prescribed medication. And I started writing about this phenomenon, but I couldn't claim for parasite because I couldn't measure actual parasite is there or not. And I started writing as a accidental cure. And so why parasite problems are overlooked? Now, I'm not going to go through all those things again because I don't have much time to go through the whole process, but stool analysis for parasite is simply not a reliable test. Many of these parasites are outside the intestinal tract. They're in the lung, they're in the pancreas, they're in the liver, they're in the brain, they're in the muscle. And if you don't treat them with a aggressive approach, these parasites will migrate to the deeper level. So if you don't kill them from the GI tract, they may go to the lung. And it's not common, but I see a couple of cases that have a pneumonia, bronchial symptoms, because they were hiding, going into the lung. Have a patient developing diabetes, getting worse. They're going into the pancreas or going to the brain. So this is not an easy thing to deal with it, but anyway, I do use meridian system to track them and going after them. So these parasites have a complex life cycle and ecosystem, and they are really hard to kill. And I don't have a 100% success. I'm still using different techniques to unmasking those hidden problems. So we have a classic 4 different types: protozoa, helms, roundworm, tapeworm, flukes, and also ectoparasite. And this is a very important slide here. Now, parasites have their own parasite. They bring their own bacteria, fungus, virus. They bring what I call concurrent co-infections. Parasites have their own infectious relationship, either virus, nanobacteria, intracellular parasite, cell wall deficient bacteria, mycoplasma, Lyme, etc. And you can create what I call social, political, economical, emotional, and spiritual parasitic relationship. Some of the sickest people, cancer patients, often they cannot get rid of their emotional parasitic relationship. And those parasite patients at an early stage have a lot of allergy problem, but when it become an advanced stage, they become allergic, and there's nothing shows in the allergy test. The allergy test is part of my routine test besides the hair mineral analysis as a minimum screening test for my patients. So here's a 63-year-old female with a primary biliary cholangitis, diagnosed 2005, with an eosinophil count of 52%. Only thing I see is a gallbladder meridian here, niclosamide and praziquantel for 10 days for 2 cycles, and alkaline phosphatase came back to normal, and eosinophil count dropped down from 52% to 2%. And now when you get rid of one kind, there's another problem shows up. There's showing up, large intestine, pronabendazole, ivermectin, and praziquantel. So you have to go through this round of parasite medication, and you have to track them through the meridian system. There's a 36-year-old white female from Hawaii with her 3rd recurrent left breast cancer. She had chemo, no radiation or tamoxifen, and 3rd time she says she doesn't want to do chemotherapy. They are recommending mastectomy, and I'm looking at the meridian system, and one of them shown here is a dental, the lymphatic system of the jaw. And they have an allergy problem, allergy, immunology point, hormonal point. This is a part of the breast point. And then she have a liver problem, stomach meridian, and gallbladder meridian. And so I wrote an article called Toothless in St. Louis, God forbid toothless in Vienna. A lot of my patients end up going on with 1 less tooth. In our case, there are 3 of them are bad, but 1 tooth right here, I think it's number 29, and that go right into the left breast meridian. I told her to put that tooth, and there was a next week, tooth was poor, and when he got the DNA test, showing up here is a entamoeba right here, and treponema. I see this pattern over and over again. This is a dental connection with a breast cancer patient, but also I see many prostate cancer patients and almost so many cancer patients, just as much as 1,000 different patients I see with 1,000 different medical conditions. Dental connection with the rest of the body. So she went home with 1 tooth less, flying back, and she emailed me a few months later, and she said she's been cancer-free. Now, I don't just do parasite and dental. In her case, I did pick up energetically. She got heavy metals. When I checked, her mercury level was at 150. Anything above 4 is considered high. And she's also getting intravenous EMPS in Hawaii. And checking her fungal toxin, she got massive amounts of ochratoxin A at 144. Anything above 4 is considered high, or up to 20 is considered very high. And she got all those environmental toxins, including organophosphate. So she has to go through all those, what I call detox. And she's been cancer-free. The idea is not just treat for those symptoms, but make sure cancer will not come back. So I always look at dental as a part of my evaluation. One in upper panorex is a female pilot with a mixed connective tissue disease. She got multiple implants in the root canals. She cannot fly anymore. And my advice to her was, this is not a medical problem. This is a dental problem. You have to pull entire teeth and have a full denture. Now, when I tell this kind of a recommendation, 9 out of 10 people do not come back. But surprisingly, she put all the tooth out and get a full denture, and now she can fly again. When in the bottom, this patient have a blood pressure of 250 over 150. Only thing I see is a dental problem. I sent to the oral surgeon, and the oral surgeon drew the line. It's his drawing, not my drawing. Say, this was the biggest cavitation he saw, and he cleaned out, and the very next day, blood pressure dropped down to 140/90. I did not put on blood pressure medication. Within 1 day, blood pressure came back from 250/150 to 140/90. Another patient have a blood pressure again 250, 260/160. Only thing I see is a bite problem. It's like a TMJ, correct the bite the same day, blood pressure dropped down to 144, like a 85 by correcting the bite. How do I know those information? Through the meridian assessment.
About 15 to 20 minutes, Dr. Yu.
All right, I'll move along.
Thank you.
So looking for all those risk factors and interference. My main topic is a parasite and dental problem. I don't limit to that. I'll go through the whole different underlying problems. This is very important for those of you who are dentists or looking for dental connections. Dr. Patrick Stott-Becker, he's an MD, PhD neurologist from Sweden, wrote a book called Dental Caries as a cause of nervous disorders. Rather boring topics, but one of the most profound, important book talking about the dental connection with the rest of the body, especially the brain. And he talks about the cranial vein do not have valve. So there is a direct drainage, especially when you have a dental infection to the brain. So we talked about like gingival infections, the root canals and the heavy metals. All those what's going on in the dental oral cavity areas when you're sleeping. You're going to go through the passive transportation going down from the cranial vein through and also affecting trigeminal nerve, and coming from the bottom will be a vagus nerve affecting the brainstem and the brain. So here's a vagus nerve right next to here's a vagus nerve in a brainstem here, and here's a trigeminal nerve by the pons. It's all interconnected. This is the connection between what's called gut and brain connection, and also there's a trigeminal. They all play that role. It's not an accident. Concept of the homotoxicology by Dr. Hans Ragwig. So if you have a root canal and parasite, you may not get sick right away, but 10 years, 20 years later, you may develop Lyme, breast cancer, prostate cancer, all those things, and we don't see that connections. And that's the whole concept of the homotoxicology. And one of the biggest problem is that we cannot really detect based on standard tests. Even DNA tests for parasite are not particularly reliable from my point of view, as much as DNA, the CT scan, looking for the dental infection. Even cone beam CT scan often overread this cavitation and end up getting sometimes unnecessary dental operation. So this is actually, I think, my last case is a 34-year-old man from Kansas City with a seizures, and found out he actually have a astrocytoma. He had a craniotomy of the right frontal lobe resection. And he came to see me on 2018, because 2017, got recurrent tumor in MRI and recommend another craniotomy. He didn't like the other of having another craniotomy, so he's doing more intense cleansing. And during his coffee enema, he passed parasite in his bowel movement, and he came to see me because of connection between parasite and what I do. And he came basically for parasite treatment. He also have a history of traumatic divorce and fatigue, and he have unusual palpitations and some weird cardiac problems. So I checked. Here's his dental problem here. Allergy, immunology point, hormonal point. He's got this small intestinal meridian. We are looking for this pattern. And I do what I usually do: parasite cleansing, fungal, environmental toxins, and go through the dental work to be done. And he becomes stable for about a year. And I see him about every 6 months to check how he is doing. And in his regular checkup, I saw he was using cell phone. So when I usually evaluate, I usually tell my patient, keep your cell phone away because it will have an interference. So I like to see you when I evaluate. I don't want you to have a cell phone. But reading has been fairly stable for the last couple of visits. So what I told him was, why don't you put cell phone in the tray that I usually check for medications. So when I put the cell phone on, he's got nervous system showing up here. He's got history of astrocytoma. He's got the cellular degeneration point showing up, hormonal point showing up. He have a heart meridian. He have an inflammation. He been to an emergency room a few times for palpitations. And then he's got also showing up here again, the nervous system, allergy, immunology point, and also hormonal point. So then I told him to change the cell phone. He was at a 4G at this point, and then change to airplane mode, and all his reading looks pretty good. So I use it as a teaching model for patients. If you do use cell phone, you can use it, but most of the time put on airplane mode. Now, I have a hard time convincing my patients. Sometimes people do muscle tests, and that thing is some kind of a sort of like a show. They don't take it seriously, but when I tell them which particular meridian is affected by cell phone with the EMF effects, they take it more seriously. Now everybody responds the same way. Some people will be just a hormonal point. Some people will be just on the immune system. Some people just show on the nervous system. Not all those points will show all at the same time. Some people are not affected by cell phone, at least not with 4G. And we don't know what's going to happen with the 5G. So let's just give you an example. I don't just check for the dental and parasite, but EMF is one of the parameters I look for when everything else fails. And this is some of the dirty electricity, radio frequency, EMF, are those causing symptoms. I don't have to go through this. Most of you know this already. And these are all creating a condition why we're not getting well. And I think that will be my last slide. So I'm just looking for all those different parameters. I look for infections, environmental toxins and carcinogens and pesticides, insecticide, nutritional problems. I don't depend too much on genetics. I'm more on epigenetics. And other aspects, social, dental, EMF, and toxic emotions, that's all driving that, what I call metabolic dysfunction. Mitochondrial damage will show in the extracellular matrix. I check through the meridian system, the progression, either you have a Lyme, post-Lyme, any chronic disease, neurologic disorder, or cancers. I'm looking at through the meridian system. So I think let's just give you a quick overview of what I do. And I think there will be here's my my website, preventionandhealing.com. 10 years ago, I wrote a book called Accidental Cure. And last year just came out with a accidental blog in medicine. So let's just give you a quick overview.
All right, wonderful. Thank you, Dr. Yu. A couple of questions people have. One is on your training information. So I know you do the AMA training, I think twice a year, correct?
Yes. Mm-hmm.
Okay, so people can go to preventionandhealing.com and learn about that. I had the opportunity to take that course last year, and I highly recommend it for any practitioners that are interested in energy medicine, EAV, electrodermal screening, those types of things. It's a fantastic few days in St. Louis. There was a question about what type of EAV or AMA diagnostic devices or testing equipment do you use in your practice?
I have 7 different kind I have, but the one mainly I use is a Medtronic called Supermora. That's the main one I'm showing. But I do have a kindling, I have a lesson system, I have a Biotron, and there are a few more different kind. And
A Syra, an Avatar, and he
well,
has all the toys.
yeah.
Okay, beautiful. Let's see. For someone that already has 4 titanium implants, what would you do to mitigate the negative effects of the titanium implants?
Well, as long as I don't see obvious problem, as long as I can handle, I may leave it alone. So I never make a decision based on is a titanium or high galvanic current, because your body can handle it. Now, I don't like implants, especially titanium. The titanium can have a high voltage running through about 200 to 240 millivolts, when normal should not exceed more than 5 to 8 millivolts in normal tools. So it can be a potential problem. So when you have for titanium, sometimes you may have to differentiate out of the 4, which one might be more energetically creating a biggest problem. Because trying to undo that implant is not fun things to go through. People often refuse to do it. They'd rather die than go through that, undo that whole process.
Do you start treating parasites prior to doing the dental work for cavitations, or is it best to wait?
As a rule, I do general detox and lymphatic drainage, and maybe I'll put on some dental drainage, go through the parasite cleansing, give out nutritional support, and then dental work to be done. That's the general rule, but there's always an exception to the rule, especially patients coming from flying in from East Coast, West Coast, or from another country. And dental is such an obvious problem, and I don't know any dentist I can refer to. I may do dental work to be done right here in St. Louis as an emergency. I'll call the dentist and then go through the parasite cleansing.
Practitioner says, I have a patient with eosinophilic esophagitis and severe coughing that's failed numerous treatments. She had complete home remediation for mold, tested negative for biotoxin illness. Have you seen a relationship with parasites and this issue?
It's some sort of parasite problem until proven otherwise, but the question is, are we using enough dose to kill that parasite? And a lot of times, if you don't kill those parasites, you will move to a different place and they will come back again. It's a sort of I've been doing for 20 years now, and still it's not a perfect system. But yeah, eosinophilic, high count, the esophagitis, oh yes. But then don't forget, I see patients with the high in like a benzene, ethylbenzene, and all those other environmental toxins and pesticides creating their conditions, not just one thing.
There's a question about which lab you use to measure the oral microbiome in the slide with the 52-year-old patient. Was that DNA Connections?
Yes. Mm-hmm.
So DNA Connections.
Right. It's not really a microbiome. I guess it's a DNA test. I'm using it as a forensic evidence. I think they check for about 90 different microbes, including some virus and fungus. They talk about at least several hundred microbes in the oral cavity area. So it's not covering all, but at least it gives you some idea. And as empirically, before they do dental operation, do put them on antibiotic, usually doxycycline. And I used to use clindamycin and the clindamycin, but after the DNA test, I see so many people have an entamoeba. I use tanadazole and doxycycline with a niacetrin. Sometimes I will add different type of antibiotics, but those are my mainstay for at least 10 days to 3 weeks, the day they start on dental operation.
Among patients who have significant parasitic problems, have you observed correlations between those you test as abnormal with your AMA technique and other more common symptoms or tests? For example, some feel bruxism is a huge sign that is also common, high eosinophil percentages, and so on.
Right, the bruxism and TMJ-like symptoms, including the tinnitus, is often caused by parasite problem. I learned from one of my Mexican patients, what she's saying is when children have a bruxism grinding their teeth, in Mexico, pediatricians put them on automatically parasite medication and often bruxism goes away. So just give you an idea.
There's some questions again about the device that he mentioned. So the primary one that he mentioned is the MORA, which is M-O-R-A.
Right.
How do you treat? Yeah, go ahead, Dr. Yu.
Kindling is another one I use as a for follow-up patients. Kindling from Germany.
How do you treat strongyloides flukes and myiasis that has become so prevalent?
Yeah, it's an ongoing process. And believe me, I don't have 100% success. And I go through the cycle. Often I go through parasite cleansing. Often I use ivermectin, parental palmoid, praziquantel. So if you have a strongyloid, there's a good chance you also have some flukes and tapeworm at the same time. For me, I get this clue through the meridian system and how they respond to it. And when you clean them up, often then fungal problem shows up. And then the protozoa, the entamoeba, like those microscopic parasites show in a different meridian system. So you have to go through this process, and it can be very frustrating, especially people coming from another state, from East Coast and West Coast, from another country. They think they can take just 1 or 2 rounds and they were taking care of it. But often that's not the case. And sometimes dental problem will all of a sudden show up in a different spot. And you have to go through the dental, have to be done too.
Do you usually give parasite medications one at a time and rotate through them, or do you give several simultaneously?
Or usually I never use single parasite medication. Minimum of 2 or 3 different combinations of parasite medication, and including natural parasite remedies that have a wormwood, black walnut, clove oil, and some antifungal medication, and go through the cycle. The most I ever used in one patient was 5 different parasite medications on some of my patients who have some cancer or some serious problem for a long period of time. Also, one of the patients was actually a physician, and he knew enough about the parasite medication, and he realized I'm going to put him on 5 different parasite medications for such a high dose. His response was, "Are you going to kill me?" And so my response was, "Well, we'll find out. Well, if you don't call me back how you're doing, I assume you're dead." And he didn't call me back, so I assume he's dead. And 1 year later, I saw him at a conference, and he looked much better than before. So anyway, most people do very well. About 90% of people tolerate high dose. In fact, underdosing creates an even bigger problem. High dose, it seems counterintuitive, but have a less side effects because you're killing the parasite. If you underdose the medication, they may hide to the whatever is a safe place. They will go to the deeper layer of the organ system. While the worst one will be pancreas or liver.
There's a few questions around how do you obtain different anti-parasitic medications? Many are seemingly unavailable in the US or extremely expensive without insurance.
Yeah, I'm having the same problem. One of my favorite was ivermectin and either albendazole, mebendazole, levamisole, and 2 years ago, I was organizing my conference, and FDA agent attended the conference. I thought it was very odd. She must be a very open-minded FDA agent. And the next thing I know, I cannot get ivermectin, I cannot get levamisole. The albendazole price went up 400%, 500%. So I'm scrambling to use a different kind of medication. So I cannot use levamisole. I may use a niclosamide and different combination. I'm trying to just balance the meridian system. That'll give you a clue what kind of parasite my patient have. And so I'm kind of playing with this, whatever is available for my patients. And a lot of people go to farmers market, get the animal grade parasite medication. I don't officially endorse people doing it, but I don't stop them from doing it because they cannot afford it. It's too expensive.
There was a question earlier about different parasite medications. In the back of the latest book, The Accidental Blow Up in Medicine, there's an appendix that has all of the pharmaceutical medications that Dr. Yu uses for different types of parasites and his dosages and so on. So that's available as a reference in that book. There's a question on how do you treat toxoplasmosis?
Yeah, there's a medication for it. I never personally had one, but I treated from North Carolina. But you don't just have a toxo, you have all those different parasites at the same time. If we went to the toxo, we have to go through all those tapeworms, flukes, and nematodes. And then eventually we went through the toxo. And I don't use that often, so I have to look it up. My own reference to look at the dose, and I was collaborating with a physician in North Carolina. And then when we actually went through the toxo, she finally improved. She was a nurse, and they tried to put in a locked-in unit on more than one occasion as a psychotic. And I was told by the physician in North Carolina that she's simply a totally new person now and fully functioning.
Do you think that parasites can be treated with herbal medications? Are they strong enough as an alternative to pharmaceuticals?
You know, I tried before 2001, I was already starting hold the clock, and I was using natural parasite medication, and it seems doing fairly well for GI-related parasite problem like IBS or some mild Crohn's. But when you get into this like asthma, the cancer, or the deep embedded parasite problem, that's simply not strong enough, because they're not strong enough to go into the lung or brain, and we have to use a massive dose. But I still use natural parasite remedies at the same time, or in between the parasite medication when I give them cycles of the medication.
If one is extremely sensitive and cannot handle the assortment of antiparasitic medications, what are some of the gentle tools you might start with?
It depends on how they respond. As long as they respond and not have adverse effects, I tell my patient, don't be too scared, because they have sometimes bad reaction. I tried the ivermectin, and they have so much side effects. And I say, how many milligrams did you use? How many milligrams your doctor used? They use 3 milligrams, and I use about 36 to 48 milligrams of several different combinations. When you use higher dose, you have actually less side effects. So I know it sounds all counterintuitive, but I treat them with a bowel cleansing, make sure they have a lymphatic system is open, kidney is open, liver is open, to all the homeopathic remedies if I was trying to kill those parasites. And many people do very well. They're really surprised how much they can tolerate.
There are several questions here related about elaborating on the vagus nerve, trigeminal nerve connection, its connection with blood flow, and also is atypical trigeminal neuralgia with past root canals likely a parasite issue?
Yes. So I see that pattern with the gallbladder meridian is one of the most complicated, complex meridian system. I'm measuring from the toe. It controls so many different part of the body, including brain, and as much as a trigeminal nerve, what's going on in the dental areas, creating is right there by the brain center and by the pons, and that cause so many neurologic symptoms. Either have a brain cancer, MS, ARS, Parkinson's. They all have the dental problem. I'm picking up through the dental point in the meridian system and through the gallbladder meridian, and the stomach meridian is another important one going through the brain.
When you find dental issues with AMA, do we have to remove teeth? Taking a tooth out is not different than an amputation. It's like cancer. Cutting it out isn't the solution. Is there a way to treat the dental issues and balance the oral biome, avoiding extraction?
Well, that would be the idea. Often when I'm dealing with a patient with ARS or cancer, I don't have time to give time for it to heal. It will be too slow. When I see cancer patient or ARS patient, you have to move the tooth by next week within 10 days. Otherwise, I'll pull the tooth by myself. Just a shot of whiskey and I'll pull the tooth. I threaten my patient with a big plier, and they usually get the dental work done, or they never come back to see me.
Your thoughts on the use of fenbendazole in the treatment of various cancers?
Yeah, it's interesting. I believe it's a fellow named by Joe Tippin, if I remember correctly. It's a fascinating story, but I'm basically having same experience with using albendazole, mebendazole, and all those different parasite medication. Now the beauty is albendazole, you can get it from farmer's market. So I have no say about that. And sometimes they try and they don't respond because albendazole alone is not enough. And sometimes they'll bring their albendazole. I do have it in my office, check albendazole, and about 60% of people may respond. 2 out of 3 people, 1 out of 3 people do not respond to albendazole, and they may have to use different combinations. So it's not usually a smart idea to use albendazole alone. Saying that, if you're not on your own, because a lot of people are desperate, I recommend to look at my article wrote on the parasite medication for treatment hacked by MIT engineer. What is her website?
I think is it debugyourhealth.com, Susan Lushas?
Right. I don't want to put her name up, but anyway, but she have a detail about how to detect using form of a muscle test and how to get the medication through the internet. It's not my #1 choice, but many people are so desperate, sometimes they need that kind of information to be out. But also don't forget that it's not just one parasite medication. You have to go through the cycle of it, so different combinations. And often you need antifungal medication and different problems pop up. When you go through these different parasite and fungal medication, then your body starts releasing heavy metals and mycotoxins and all the environmental toxins. So I have a couple of cases where female completely losing hair while put them on parasite medication, and they get panicked because they think the parasite medication make them to hair loss. And usually when I check again, often whether it has a directly related with a parasite medication or not, when I check and measure it, have a massive amounts of environmental toxins, pesticide, insecticide, and all those petrochemical byproducts.
Have you used your AMA testing to explore disulfiram as a anti-parasitic agent?
I not really. I have with me, but I just don't, not enough experience for me to give you even advice on that one right now.
Do you recommend implants after a tooth removal, and do you generally find the person then tolerates the implants with your AMA testing?
Yeah, so it's a tough question actually. I usually tell my patients do not get implant right away. But sometimes people do way too aggressive to pull the root canal out and get the implant in the name of correcting the bite, lymphatic drainage of the brain, and etc. But they're way too aggressive, as many people still have a residual infections and they have an implant, and eventually implant have to come out. Now, if you have an implant, but as long as your body can handle it, I don't tell them to remove the implant, but I tell my patient, that's still the stress in your body. And it may become a problem few years down the road, but you don't have to put the implant right now.
Do you generally pulse anti-parasitic medications, and do you find there's a need to correlate the treatment with the moon cycles?
Yeah, when I go into the maintenance, so there will be a parsing. In the beginning, I don't worry about that. And then once going to the maintenance parsing, then I usually go by full moon as a cycle of the beginning of the parasite medication. But some people are very intuitive, and they will say, but I feel better when I take during the new moon. So I said, then go through listen to your body, your intuition, and go through the new moon cycle. Most people recommend start with the full moon cycle.
Beautiful. Dr. Yu, this was a fantastic presentation. We appreciate all your great information. I urge people to get a copy of his latest book that has a lot of the parasite protocols outlined there. If you're interested in energetic testing, the AMA courses are also fantastic, preventionandhealing.com. So thank you so much, Dr. Yu, for being with us today. We appreciate you very much.
Well, thank you for the invitation.
All right, be well.
Mm-hmm.